Mr. Speaker, I yield now to the gentleman from Kansas, Mr. Huelskamp, for 1 minute 30 seconds.
Gentleman from Kansas is recognized for 1.5 minutes.
Thank you, Mr. Speaker. I want to thank the chairman for his work on this bill. And as a member of the Veterans Affairs Committee, I want to take a moment and share a little about what this bill means for my Kansas veterans. Since coming to Congress, I've heard dozens of stories from Kansas veterans about their troubles with the VA. They have shared about how they are required to travel hundreds of miles for simple medical tests or to renew their prescriptions, all the while driving past dozens of local hospitals and other health care providers with the ability and desire to meet their needs locally. Many Kansas veterans drive halfway across the state or to Colorado, Nebraska, or even Texas to get their simplest health care needs met. In fact, just yesterday, my office had to step in and help a 94-year-old World War II veteran. The nearest VA hospital was 240 miles away. He just had a recent serious surgery. They said you have to come into the hospital to renew your prescriptions. Thankfully, I was able to contact the VA and ensure this veteran could get his care in his local community. But as I tell folks in Kansas, you shouldn't have to call your congressman to get the care you deserve. With this bill, hundreds of rural Kansas veterans will be able to use their new Veteran Choice Card, or Project Arch, call their local doctor and get their health care needs met. Just like Medicare or TRICARE, veterans should have the choice to schedule their own appointments, pick their own doctors in their own communities. When our veterans come back from serving and defending our country and return to communities across the United States, most of them don't ask for much. But I want our veterans to know that I believe you deserve the best, not just a mediocre, scandal-plagued culture we have seen at the current VA. This bill is just plain common sense. It is a big first step towards giving veterans real choice and real accountability. As this law is implemented, I remain committed to continuing to ask the hard questions and working to return the VA to its true mission to serve our veterans. I yield back.
Gentleman